Good morning or afternoon or evening. It's morning here. But we are entering September, so it is getting a little chilly outside. Really good time for reflection. So I thought I would make a video talking a little bit about what I've been up to and doing the last couple of weeks. So last week, I did my first 1 million cups presentation and went really, really well, but I was very nervous because I haven't done a speaking event in a long time. I think the last one I did was pre-COVID, so that's like 2018, 2019. But it was really good to kind of get back into it, talk a little bit about Legacy Bio Studios, about myself, and in all honesty, when I had signed up to do 1 million cups, I wanted to talk about the maternity education lookbooks. And so what I ended up doing, with the help of a new friend that I had made at a previous 1 million cups, he was presenting his new business. Trevor Brighton, I hope I'm pronouncing his name right. Trevor Brighton, I'll have his contact info below, works in branding and marketing. And so he was really helpful and very kind to offer his time to help me kind of workshop my presentation and make sure that I was telling the best stories to get the information across. So that's what Trevor does. He uses storytelling as a way to get information to the audience. And it's really effective. It's a lot more entertaining than just slides of facts and figures. So for my business, the storytelling came from, okay, who am I? What do I do? The case study showcasing the maternity education lookbooks was the story of why my business has value. From there, we talked about my background, how I got into the field, how I learned about the field, honestly. And then from my educational background, we talked a little bit about my soft skills that I developed over the years actually working as an illustrator. And also, a part of that was my experience as a patient advocate, because I had done some illustrations for my mom early on during her cancer treatments, and that did have a significant impact on how I tackle projects now. So all of that information, the case study being one of the main stories, talking about my mom's cancer illustrations that I made for her being a second story, and then of course covering more of the logistical stuff like my market and who's my ideal client and my goals for the near future. And with that in mind, telling stories, I wanted to share a story with you today. When I had first started doing promotion about the maternity education lookbooks, every once in a while somebody will ask me, why did you translate the books? Like, everyone's appreciative of the translations, but every once in a while you'll get somebody that has realized that's a lot of time. Why did you invest the time to translate these books? And the honest truth is, I made that choice to translate the books. The client that commissioned the project, we didn't really go into that, and so I made the choice to donate that time to this project and translate it. because I saw that it needed to be done. And the reason that that mattered to me so much is because of a boy I met when I was 10. So at the time, when you're 10 and you're seeing other 10-year-olds doing things, you kind of are like, yeah, okay, because you're also 10. You're not realizing that you are, in fact, children, right? But as an adult that now has people in my family that are 10, and I look at them and I go, you are a child. My expectations for you are very different than what I saw children taking on as a fellow 10-year-old, right? So my mom had her own dental practice, and I would go to her practice every day after school. I did my homework there. After I was done with my homework, I would read, I would draw. When I got old enough, I would play computer games. I really enjoyed, what was that game? It was like Jewel Thief or something. I really enjoyed that game, Jewel Thief, and I kind of wish I could find that game again. Off tangent, doesn't matter. My point is that I spent a lot of time at my mom's clinic, and patients that had children, even if the children weren't scheduled for appointments that day, would come with their parents because I was there. So that was how I made friends. I would make friends with the children of my mom's patients. And we would, color, we would read comic books together. And I remember this kid, his family was from Bosnia, and he was the same age as me. We were 10. And during his mom's appointments, we would be up front, we would be doing whatever we were doing, and in the middle of our coloring, I would hear his mom call for him, and he would go in the back, and my mom would ask him some questions. He would talk to his mom would answer the questions, and then he would tell my mom in English what he and his mom had discussed. And that was the first time, honestly, that's the first time I've ever been exposed to, medical translation. That's what this 10-year-old was doing. He was acting as a medical translator for his mother. And looking back now as an adult, as someone that has been in the role as a patient advocate, I realized that was quite a task. And a task I would not ask any 10-year-old to do. But I also am realizing that resources were not as readily available 20 years ago. So the best that we would have is if there was a translator available that spoke their language and was available during the appointment time, then yeah, there would be a translator available, but that was not always accessible. So children would act as translators for their parents. And this wasn't the only time I'd ever seen that. And I remember specifically maybe a couple years later when we were having a boom in Spanish-speaking patients, my mom had said, I'm going to go to Mexico. I'm going to work on my Spanish. I'm going to go to some clinics in Mexico, and I am going to learn medical terminology to be a better dentist for my patients. I will be able to speak to them in Spanish. That was her goal, was to be able to speak fluent medical level Spanish for her Spanish speaking patients. And she did do that because, again, at the time, the resources to access a medical translator were very limited, and it really was dependent on what the doctor was willing to do, as well as what available resources the patient had access to, whether it was maybe a friend that could come in and be their translator, but oftentimes it would be one of their children. So with that in mind, now having had that experience as a patient advocate, as well as being an adult and seeing a 10-year-old and going, oh, you are 10, you are a child, you should not be doing this, that really reinforced that concept for me of even if these expectant mothers coming in to these WIC clinics, even if they do have a translator with them, there is still not readily accessible resources to guarantee that every time these patients come in, that they have a translator available. So, and I asked, and they did say that sometimes children, if the expectant parent couldn't find a friend to come with them, and they did have an older child, that still happens, where sometimes a child will be a translator, and they do try their hardest to accommodate and find translators, especially if they have one on staff that can stop by real quick and help answer some major questions. But for the entirety of the appointment, there is no guarantee that there will be a translator in the room. So I saw a problem, I offered a solution. And that is why I spent all that time translating English to Spanish to French, and scoured the entirety of the internet to make sure that I was at least mostly well translating Swahili. All because of a 10-year-old that I had remembered. And I think about this kid a lot. I think about this kid, especially the more I'm involved in patient outreach and projects that are related to public health. I think about that kid a lot. We didn't stay in touch. I have no idea where this kid is now. Maybe he's a doctor. Maybe he is now a medical translator. I have no idea, but I hope he's doing well. And I want to thank him for embedding a core memory in my head that is now helping patients now be able to better participate in their healthcare.